In this lecture, we shall introduce enteral routes of drug administration, and then we shall focus on the oral route of drug administration. So first, I want to define the term enteral. Enteral is defined as giving the drug in any site of the GIT. We have 4 types of enteral routes. First, we have the oral route where the drug is administered through the mouth. The next we have rectal where the drug is inserted into the rectum for a systemic effect. Then we have 2 overlapping routes, that is sublingual and buccal. We shall focus on the oral route of drug administration. We take food orally. So when you think of the oral route, remember that we take food orally. So drugs that are given orally are divided into 2 types of dosage forms, namely solid dosage forms and liquid dosage forms. The solid dosage forms include capsules and tablets, while the liquid dosage forms include, amongst others, syrups, solutions, suspensions, and elixirs. Now we shall look at the sites of drug absorption. When you take a drug orally, it is absorbed through 3 key sites, namely the stomach, the small intestine, and the large intestine. Of these 3, the principal site is the small intestine, and in the next slide, we shall look at 3 reasons why drugs are mostly absorbed in the small intestine. The small intestine has 3 anatomical features that promote drug absorption. First, it has many folds, and this increases the surface area, and this increases drug absorption. Secondly, it has many microvilli or villi, and this increases the surface area, and this increases the rate of drug absorption. Thirdly, the blood supply to the small intestine is very good, and this increases the rate of absorption of drugs in the small intestine. We shall now look at 6 advantages of the oral route of drug administration. When you think of these advantages, remember it is easy to eat food. So the first advantage, it is convenient because you can take medicines at any time and place, and it's a very simple route. Secondly, it is safe because it is non-invasive, and the risk of harm and infections is very, very low. No skills are required You don't need any skills to eat food. Next, it is cheap. You don't need any instruments. Next, it is non-invasive. Organs do not get injured when giving drugs orally, and sterile conditions are not required. The drug does not need to be sterile, and you don't need to sterilize any surfaces. So if we look at disadvantages, there are 8 disadvantages. First, the patient may be vomiting, and this can lead to loss of drug when the drug is given. This is especially so if the drug is bitter and unpalatable. Some drugs cause gastric irritation, for example, ferrous salts, and this leads to nausea and vomiting. And lastly, in terms of absorption, the oral route is slow and absorption is very erratic compared to other routes such as the intramuscular route. Now we shall look at additional disadvantages. I will list this here, but I shall elaborate them in the next slide. We have the first pass effect. It's not suitable for emergencies because absorption in the oral route is delayed. If there's an emergency, the oral route is not suitable. Again, a patient may not be able to swallow the drug if they are unconscious. And then the oral route is not suitable for acid labile drugs. And there's the risk of food drug interactions. I will describe these 3 phenomenon individually in the next slides. We'll now first start by describing the first pass effect. The first pass effect is defined as loss of the drug by metabolic processes that occur in the GIT, in the gut wall, and the liver, so that the amount of drug reaching systemic circulation is greatly reduced. So in this diagram, this represents the gut. The gut has enzymes that can destroy the drug. Even if the drug is absorbed, it can be transported to the liver by the hepatic portal vein. Once it reaches the liver, it can be metabolized to inactive metabolites such that finally the amount of drug reaching the liver is far less than 50%. Some drugs undergo first pass effect. First pass effect is also known as pre-systemic elimination. Disadvantage that we talked about was acid labile drugs. A drug is said to be acid labile if it is destroyed in the acidic environment of the GIT. An example of a drug that is acid labile is benzyl penicillin. I've put the structure here. So this drug cannot be given orally because it is destroyed in the acidic environment of the GIT. Lastly, we look at food-drug interactions. A food-drug interaction is whereby when a drug is taken with food, its absorption is reduced. For instance, when tetracyclines and fluoroquinolones are taken together with milk, the calcium in the milk undergoes a chelation reaction with these two antibiotics, forming products that are insoluble and therefore cannot be absorbed. So this is an example of a food-drug interaction. Food also slows down the absorption of drugs. So that is the last disadvantage we are looking at. In summary, we have listed the enteral routes. We have looked at the sites of drug absorption, the advantages and disadvantages of the oral route, the first pass effect, food-drug interactions, and acid labile drugs. So this is the end of the lecture.